I want my patients to understand that I view the patient-surgeon relationship as much more than just the time we spend in the OR together, the operating room. I think that you have the commitment of me and my team from the first time you show up in the office through when you're fully recovered, and even beyond. I like to check in with my patients in the long term over the years. So I think that they've pretty much got a lifelong commitment from me and my team. Patients should choose Washington University because we have a commitment to providing the best treatment for your condition, regardless of what that condition is. It might be something that you see as relatively minor or something life-changing, but we can provide the best treatment regardless of what that condition is, and I think there's some comfort in that. I trained here as a fellow in spine surgery, and through that training, I came to realize that everyone here kind of shared the common thread of striving for excellence at all times. I was practicing in New York prior to coming here, and when the opportunity arose, something I jumped at because of that commitment and striving for excellence. I didn't consider becoming a physician until college, really. I was a student in biomedical engineering, and it was through my interaction with the physicians that were part of that program that helped me realize that I think personally I could have the greatest impact on people's lives and the greatest impact on my community by becoming a physician. Spine surgery is a specialization within orthopedic surgery. So I think that for me, coming from kind of engineering and having exposure to a lot of sort of mechanical things growing up, whether it be working on cars or boats or construction projects with my father, orthopedics was kind of a natural fit. It's a very mechanical field. And then beyond that, you sort of have to find the value in the treatment of orthopedic surgery. So, and I'm part of this. Many of us as orthopedic surgeons, we were at one point in our lives patients ourselves. So for me, that was a soccer injury. Some other people that I know, their family members were patients, and so they have a very close connection with orthopedic surgery in that regard. But for me, it was a personal experience. Patients come in and they're in the spine world, they're either in so much pain or they have really no ability to do the things they want to do in life. Some patients can't even walk, say, a couple of minutes without the legs giving out, or they can't stand up straight. And so bringing them through the surgical process and then seeing them in recovery, I don't see them every day. I see them in snapshots, say every couple of weeks or every couple of months. And so every time I see them, the strides that they're able to make is really dramatic. And so when they're fully recovered, I have very clear pictures in my mind of when they showed up and then when they recovered. So, like I said, those snapshots give me a real comparative view. And so it brings a lot of joy to see them so much more functional.